Assalamu alaikum. My name is Dr. Zoha Rahim from Department of Gastroenterology and Hepatology, Sheikh Zayed Hospital, Lahore. The topic of my presentation is long-term medical complications in single donor liver transplant patients presenting to a tertiary care hospital. In the coming times, liver transplant has become one of the most effective therapy for acute and chronic liver failure, but still it remains a complex procedure due to the accompanying complications. Previously, there were poor survival of patients after liver transplant, but so previously people were more concerned about the immediate complications following liver transplantation. However, with the increasing survival rate, the liver transplant now, due to better operative and post-operative technique and immunosuppressive therapy, has led to a concern regarding the late onset medical complications occurring in the post-liver transplant patients. So this study is basically about the long-term medical complications which patients face after a liver transplant. The objectives of my study were to determine the frequency of development of long-term medical complications among single donor liver transplant patients, plus the association of these with age, gender, duration of post-liver transplantation, pre-transplant history of diabetes, hypertension, dyslipidemias, and central obesity among these patients. A total of 111 post-liver transplant patients were presented to the Sheikh Zayed Hospital OPD, and according to the inclusion criteria, they were approached and informed consent was taken. About their age, sex, blood pressure, central obesity. They were all entered into a performa. So careful clinical history was taken with all the medical complications pre and post transplant, and an overnight fasting sample of triglycerides, cholesterol, HDL, and fasting blood sugars were also taken, and similar samples were also taken for creatinine, urea, LFTs, and additional tests according to the patient's clinical history. So among the total results, there were 70% female patients and 30% male patients involved in our study, and the most significant results were seen in altered bowel habit, which was 69%, followed by epigastric pain, which was 55%. There were many neurological complications, for example, nerve palsy, 28%, numbness, 52%, stroke, 10%. Many patients faced shortness of breath and palpitations, as well as chest pain. There was generalized edema and skin changes and pedal edema, and the percentages are mentioned in my study. Post-transplant hypertension was seen in 80% of the patients, followed by diabetes mellitus 68%, post-transplant anastomotic biliary strictures 55%, dyspepsia 60%, cardiac diseases 51%, and metabolic syndrome was found out to be 61%. So these are the few of the post-transplant complications which were noted over the period of 1 year. So we can conclude from this study that post-liver transplant patients are prone to gain their weight when they return to their normal routines, and along with the administration of immunosuppressive agents to reduce organ failure after the transplant, obesity is enhanced. Hence, addressing the said issues and advising proper follow-up, which is recommended over the period of time, liver transplant is significantly related with BMI, obesity, hyperlipidemia, hypertension, ischemic heart disease, CVA, dyspepsia, and anastomotic strictures among the post-liver transplant group of patients. So early surveillance and diagnosis can lead to good long-term prognosis. Thank you so much.